الرحيم والصلاة والسلام على أشرف المرسلين. I'm Dr. Nermeen Abdelmenam. I'm a professor of pediatric endocrinology, Zagazig University. Our topic today, inshallah, will be on growth hormone deficiency, and short stature. Firstly, we will start with the definitions of growth and development. What about growth? It is the increase in the size of the organism due to increase in its size or number of its cells. Development is the maturation of functions, acquisition of the skills, and adaptation to stress. There are different stages of growth and development. We have three stages of growth and development. We have embryonic period, early fetal period, and late fetal period. Firstly, the embryonic period, it is in the first 8 weeks of gestation, and it is for the sake of organogenesis. So any teratogenic effect or agents at this period may lead to abortion or congenital anomalies. The second stage is early fetal period, starting from 9 weeks of gestation till 28 weeks of gestation. It is prominent for the rapid growth, mainly in length. And the late stage is the late fetal period, from 28 weeks till 40 weeks of gestation, and it is in the sake of rapid growth, mainly in weight. The second and the third stages of growth and development, in this period, any teratogenic agents may lead to fetal death, stillbirth, premature delivery, or intrauterine growth retardation. So what are the factors affecting growth and development? We have different factors, maybe factors before pregnancy, factors during pregnancy, and factors after delivery. Regarding the factors before pregnancy, we have familial factors, we have racial factors. For factors during pregnancy, we have maternal diseases like TORCH, diabetes, hypertension, maybe the mother receiving drugs or exposed to radiation, or having malnutrition, or exposure to hypoxia. All these are factors affecting on growth during pregnancy. Then after delivery, we have also different factors. Starting with age, the rate of growth differs. It is not equal all over the life. So growth is more during the infancy than the childhood. Regarding sex, both sex, male and females, having the same rate of growth till the age of 11 years. They are equal. After that, from 11 to 14 years, female growth rate is more than male. After 14, the male growth rate is more than female. The third factor is hormonal factors. During fetal life, growth is under the effect of chronic chorionic gonadotropins, placental growth factors, maybe thyroxine, insulin. During infancy, growth is under the effect of growth hormone and thyroxine. And during adolescence, sex hormones takes the upper hand. Then, what about nutritional status? Also, nutritional status is one of the factors affecting after delivery. Also, the psychological status, other factors like chronic illness, socioeconomic factors. What about the anthropometric measures? Anthropometric measurements, it means what are the things we are measuring? We are measuring weight, we are measuring height, we are measuring head circumference, we are measuring chest circumference. All these are anthropometric measurements. Regarding the normal pattern of weight gain, the average full-term newborn baby weight ranges from 2.5 to 4 kg at birth. So its average weight about 3 kg. After delivery, the baby lose 7 to 10% of birth weight in the first 4 days of life. Why this happens? What are the causes for this, for loss of weight ranging from 7 to 10% of birth weight? The causes are different. Firstly, loss of extra fluids as urine and meconium, little amount of feeding due to weak suckling power and minimal breast milk. But for the good sake, the birth weight loss is regained by 10th day from 7 to 14 days actually. The child doubles his weight at 4 months and triples his weight at 1 year and quadruples the weight at 2 years. Sorry. We have different equations. We can calculate the expected weight. From 3 to 12 months, we are adding the age in months plus 9 divided by 2. From 1 to 6 years, age in years multiplied by 2 plus 8. And from 7 to 12 years, age in years multiplied by 7 minus 5 and divided on 2. So weight is the best measurement of nutrition and growth. Presence of wasting alone indicates acute energy deficit, while stunting implies long-term energy deficit, and the combination of both wasting and stunting implies an acute nutritional insight superimposed on long-term energy deficit. What is the meaning of these words? This means that if we have acute defect or acute energy deficit, it will affect on the weight. If we have a chronic or long-term energy deficit, we have a chronic systemic illness, it will affect on height. If both are affected, implying wasting and stunting, this means that there is acute nutritional insight superimposed on long-term energy deficit. In this picture, there's a boy. We are checking for him his height. We are measuring his height. We are using a stadiometer. It is the instrument used for measuring standing height. Normal pattern of gain in stature about term newborn. His length is about 50 centimeter. At 1 year is 75 and at 2 years is 90, and he doubles his length at the age of 4 years. There is also a formula for calculating the expected height between the ages of 2 to 12 years. We are multiplying the age in year multiplied by 6 plus 77, and by the age of 13 years, the child triples his birth length. So his birth length is 50 centimeter. He doubles it at the age of 4 years and triples it at the age of 13 years. And there is also adolescent spirit, and this happened in girls or females at the onset of puberty, at the start of breast development. But in boys, the most adolescent spirit takes place at the age of 14. This is the head circumference measurement, and it measures the period of maximum brain growth. It can be used, it can be measured through using a tape over some landmarks, including the occiput above the auricle on both sides and supraorbital ridges. Also, there is normal increase in head circumference. Mainly, the main increase is during the first year of life. The head circumference at the birth is about 35 centimeters. This is a full-term baby, and reaches 49 by the end of 3 years. Then the adult size is 55 for females and 57 for males. It is attained by the age of 8 to 10 years. What about the body proportions? As you see, we are checking the upper segment and lower segment. The lower segment started from symphysis pupil to the heel, and the upper segment we can calculate by checking the height. Then after checking height and measuring height, we are subtracting the lower segment from the height, and this gives the upper segment. We have a very important ratio. It is the ratio of upper segment to lower segment. If it is high, means there is a short limbs and it occurs in achondroplasia or rickets. If it is decreased, meaning a short trunk in case of some metabolic disorders like mucopolysaccharidosis. If it is normal, this means that it is a proportionate short stature. This means, what is the meaning of proportionate? Proportionate means that these ratios are attained in the normal values of the normal child, so it is proportionate. So useful body proportions like upper segment and lower segment ratio, arm span to height, and chest circumference to head circumference ratio. The upper segment to lower segment ratio, its normal values or normal ratio at the age of birth, it is 1.7 to 1. At the age of 3 to 4 years, it is 1.3 to 1. The ratio is 1 to 1 by the age of 7 to 10 years. So if we have a boy, he is short, his age is 3 years old, but his upper segment to lower segment is maintained at the same normal ratio, which is 1.3 to 1. This means that it is a proportionate short stature. This is the picture of measuring the arm span. We are extending the upper limb horizontally and making each arm abducted at, to 90 degrees. Then we are measuring from fingertip to fingertip, and this is the arm span. Actually, in children, arm span is 1 to 2 centimeters shorter than the height. In adolescence, the arm span is the same. In adult, arm span exceeds height by about 5 centimeters. We are seeing long arm spans in boys and African American descent. Also, arm span when compared to height is another useful index about the proportionate or proportionate short stature. We can differentiate proportionate from disproportionate through the ratio between the arm span and the height. Another more tool is the assessment of bone age. During fetal life, there is some ossification centers that begins at the age of 5 months intrauterine. Like long bone ossifications occurs in as calcaneus, talus, cuboid, proximal tibia, and lower femur. This is the intrauterine ossific centers. This means you know before that there are different factors affecting the growth. During intrauterine life, we have placental growth factors, we have thyroxine, we have insulin growth factor. All these are factors affecting fetal growth. So if we have hypothyroidism starting early in intrafetal life, this means that it will affect on the growth, it will affect on ossification center. So if we have patients screened for thyroid function and it's coming positive, we can make X-ray on the knee joint. It will appear, it will comment on the ossific center. It is absent. If it is absent, the lower end ossific center of the tibia or the is the lower femur ossific center and upper femur, upper tibial ossific center. This means that this congenital hypothyroidism starting early, affecting through the intrauterine life. During assessment of bone age, we have also extrauterine ossific centers. We have carpal bones. The number of ossific center we can calculate in age plus 1. Roughly, if we have a boy 6 years old, this means that we will have 7 ossific center. If we have a boy 4 years old, this means that we are having 5 ossific centers. The eighth ossific center appears between 10 to 12 years old. What are the causes of advanced bone age or delayed bone age? Delayed bone age will take place in growth hormone deficiency, in hypothyroidism, in malnutrition, in chronic illness, constitutional also. In advanced bone age will take place with growth hormone hypersecretion, with hyperthyroidism and simple obesity. Another more topic is the growth chart. It's a very important topic. What is the meaning of growth charts? What are its definition or what is its definition? Arranging a particular child in comparison to other children of the same age and sex. So after measuring, say, the height or the weight, we are plotting our measurements on the growth charts. What are the types of growth charts? We have centile curves. They are graphic presentation of patterns of growth. For every character of growth like height or weight, the chart includes centiles. We have the third centile, we have the fifth centile, we have the 50th centile, we have 95, 97, and this indicates the deviation of values above or below the mean. The mean is the 50 centile, which means the commonest value for age. For example, in body weight for age chart for boys at the age of 4 months, the value 6 kg lies at the 50th centile. So this is the mean value. Values below 3rd centile or above 97th centile are considered abnormal. These are the extremes. So if it is less than 3rd, for example, for height, less than 30 centile, this means the patient is short stature. If the body weight for child aging 4 months is 4 kg, we are plotting on growth chart coming with below 3rd centile. This child is referred as low body weight. This is an example of the growth chart. As you see, the 3rd, the 50th, and the 97th centile. Also, we have growth velocity curves. This to determine the rate of growth per time unit. This requires 2 measures to the same person with known time interval, like مثلا every 3, 6, or 12 months. What are the values of growth charts? Actually, growth charts are very important. Firstly, we can detect abnormal children. So if we are we're having a patient coming and we check his height and we plot it on the curve and it comes less than 3rd centile, so we are doing further investigation to investigate what are the causes of this situation, why he is below the 3rd centile. So it detects abnormal children, we need to investigate. Another value is an easy method for assessment of growth. 3rd value is we can detect early the protein energy malnutrition. We will have flat curves, and we can also monitor the success of therapy. Say we have a short patient due to growth hormone deficiency, and we started growth hormone. So we are following the growth of this patient. If his height is increasing, we are checking is crossing 4 centile or it is the same stationary or flat curve. So we are monitoring also the success of therapy. And lastly, we can use it for research purposes.